order to have a concrete discussion about your condition. Imaging is really where we get under the covers and get the truth of the real situation. And the way that works is one of my staff will help you upload your imaging to a totally confidential site on the internet, which we can then access so we can both share and talk about on the show. So feel free to call in. I'd love to hear from you. And other than that, let's get started and see what's going on. Well, the news starts today with this really interesting article from Bustle. It's called, "Here's Why Your Knee Hurts When You Bend It." And the article is about actually the Patellofemoral Syndrome. Now, I'm sorry to say we do start out with a quote, and I want to read it to you and then talk to you about it. "As it goes with any type of pain, there are lots of reasons why your knees might hurt when you bend them, including injuries to the ligaments and meniscal cartilage of the knee," says Dr. Grant K. Redermacher, DC, chiropractor and owner of Ascent Chiropractic. Quote, "But as much as ACL tears and meniscus injuries are talked about, unless you've been out playing high-impact sports and had a sudden onset of pain, it's unlikely they're the root of your problem." No. I don't know Dr. Redermacher, but one thing, and a chiropractor is certainly a qualified doctor to talk about this issue, to talk about knees. We kind of think of chiropractors a lot in terms of the spine, but those doctors are trained for 4 years and they go over all of the joints in their training. So they're certainly qualified to talk about knees. One thing about doctors, though, if their opinions over time are often very influenced, or you could even say skewed, by the population of patients that they see. And Dr. Redermacher, as a chiropractor, probably does see a lot of patients who have patellofemoral syndrome, which is knee pain. If you got an MRI, it would be largely normal. It might show some damage to the patellofemoral tendon, but it's not an ACL tear. For an ACL tear or a torn meniscus, I think more people would end up seeing a primary care doctor and then a physical therapist and then an orthopedic surgeon. Because the statement, "unless you're playing high-impact sports and had a sudden onset of pain, it's unlikely they're the root of your problem," is false. The most common cause of an ACL tear, for example, is getting out of the car. Yeah, it's not going to make the news, and you're probably not going to end up seeing a chiropractor for it. But if you take everyone, 100 people who have ACL tears, the most common cause is not sports, it's everyday activities. And the reason that happens is while you're doing your everyday activities, that thing is just holding on by a thread, and then you get out of the car and it just does that last little bit. So that's a degenerative problem that climaxes with a traumatic injury, but the trauma was an everyday event, and that's very, very common. The same thing with meniscus injuries. Meniscus injuries are very common. The meniscus is a shock absorber between your thigh bone and your leg bone. And what happens if your shocks go out? Over time, you ruin your springs on your car. When the knee doesn't have that shock absorber, everyday movement starts to become traumatic and you get accelerated arthritis. So that leads to what is actually the most common cause of knee pain, arthritis. So yeah, there are ligament and tendon injuries and there is arthritis. And then there's also this thing, which we're actually going to talk about today, called Patellofemoral Syndrome. So how do you know which one you have? How can you distinguish between the three? Arthritis pain tends to be worse in the morning when you first wake up. It's much more common in old people, and old is a lot, the definition of old depends a lot on how old you are. But let's just say arthritis is much more common in people who are 55 and older, and each year after 55, it becomes even more common. Arthritis pain is an ache. It hurts in the morning and then it loosens up with activity. That's what led to the phrase "motion is lotion." But then as the day goes on and the inflammation builds up in the joint, arthritis pain then becomes more and more tender. So more and more movement limits you. People with arthritis often they can walk across the house, but it's hard to get out and do an exercise walk, or certainly hiking on uneven terrain. Meniscal pain is associated with pops, clicks, and locks. So if your knee locks in one position, that's probably a meniscus injury. If your knee pops and cracks a lot and those cracks hurt, that's probably a meniscal injury. And pops, clicks, and locks, that's kind of the flavor of meniscus. Just from a pain point of view, it's hard to separate meniscus from arthritis. And because meniscus injuries, as I mentioned, when your shocks go out, you eventually lose your springs. Your meniscus injury then leads to arthritis. Most people are going to have both. And so it's especially hard to distinguish them just based on pain because you have both. And then there's the ACL tear. ACL, before it tears, a lot of ACLs are injured or frayed. It's a ligament that goes between the bones and it holds your knee in position. So your knee, if it tears, can become unstable, where the thigh bone can literally move forward on the leg bone. That is a giant, your body senses that as instability, locks you down with muscle spasm and limping and all the rest. So if your knee feels unstable, like it's going to give out on you, or maybe you're walking downstairs and you feel like your knee's just going to crumple, that would tend to put you in the ACL category. Who cares, right? If your knee hurts, it hurts. No, it makes a huge difference. The treatment depends on the problem. The treatment really depends on the problem. And so much time and energy and effort is wasted in painful joints with people doing treatments for the problems they don't have, or not getting the treatments they need for the problems they do have. I would say really my main goal in doing this show, best practice means linking the treatment with the problem and making sure we follow the evidence, what evidence is available, and we'll talk about the quality of evidence as a pyramid. But best practice is really all about getting the right treatment for the right problem and knowing the two. So the reason it makes a big difference how it feels is oftentimes we don't have imaging. So you want to think about the way it feels, and if we're talking about this article, we're talking about knee pain, those are kind of the categories that you want to throw it into. There's the soft tissue injuries like the meniscus or ACL tears, and then there's arthritis. And the treatments just could not be night and day more different. Think about the ACL tear. So your knee's unstable, one bone can move on another. Would it make sense to go to physical therapy? No, right? Physical therapy, which is so often the first thing that we do, physical therapy. Physical therapy really doesn't make sense because they're going to mobilize the knee and look at your station and make sure your gait is correct. And physical therapy is wonderful, but if your knee's unstable, you're not going to be able to tolerate physical therapy. So that would be just a waste of your time, the therapist's time, and your money, seeing a therapist to mobilize something that is unstable. Knowing what's wrong also makes a huge difference as far as the imaging studies. So you think your knee feels like it's unstable. Oh, I don't think it's not popping, clicking, and locking. I don't think it's meniscus. It feels unstable. I'm too young to have arthritis, or it didn't kind of gradually build up, so I think it could be ACL. I get an x-ray and the x-ray is normal, so I don't have to worry about it, right? Wrong. The ACL is a ligament. It doesn't show up on an x-ray. You can't see it. X-ray is, what do you see on an x-ray? Bones, right? You don't see soft tissues. So if you need to get an x-ray first anyway. Honestly, you should never have an MRI without having an x-ray first for a variety of reasons. But let's say you get the x-ray and it's normal, then you need to know, oh, I'm thinking it's ACL. We need to go on, talk to your doctor about having an MRI, which can show that ACL tear and lead to the proper treatment, which is reconstruction of the ACL, assuming that you're healthy enough to undergo surgery, what we call medically fit for surgery. All right, we're going to talk about the three for the knee pain, right? So we talked about the ACL, and the other one that goes with that is the meniscus, popping, clicking, and locking. If your meniscus goes out, most meniscal tears, if you're under 50, and certainly if you're over 60, they're unlikely to heal on their own. If you're over, the older you are, the less likely they are to heal on their own. And the younger you are, the more likely they are to heal on their own. Now, there are some that just don't heal. It's just, it's too far gone. You could be 17-year-old track and field athlete. You're the healthiest specimen on the planet, and yet you're not gonna heal because the meniscus has very limited blood supply for some tears. But most of them, if you're young, are gonna heal on their own. You don't have to worry about them. For older folks, and older here, I'm 50, 56, so older is, they say an alcoholic is someone who drinks more than their doctor. Well, old is older than your doctor. If you're over 55, good chance it's not going to heal on its own. And so if it's really painful, then there is an arthroscopic surgery, meniscectomy. They don't remove your whole meniscus. They go in there and just clean it up, clean out the gunk and let it heal faster and recover faster. And in some cases, they can actually repair the meniscus. So there's, from an arthroscopic surgery point of view, there's meniscectomy, clean it out, and then meniscal repair. A lot of them can't be repaired, but some of them can. And if it can, then that's usually your best option. So we talked about ACL, instability, feels unstable, especially when you're going downstairs. We talked about meniscus, locking, clicking, popping, and hurts, and how you can have meniscectomy for that. The last one is arthritis. And arthritis is, we should think of it as an inflammatory condition. So if you have arthritis of the knee, the imaging test that confirms it is an X-ray. Well, what about an MRI? Is an MRI better? Not really. The most sensitive test is MRI, but you can see it really well because arthritis is in the joint space and affects the bones, affects the joint space. So you can see it on X-ray, and if you have a diagnosis of arthritis on X-ray, you may not need an MRI. So on the imaging, X-ray is a good, really, really good place to start. So you get an X-ray that confirms, let's say you have mild arthritis. Think of arthritis, itis, tonsillitis, inflammation of the tonsils, appendicitis, inflammation of the appendix, arthritis, inflammation of a joint. In this case, it's the knee joint. Well, if you want to relieve arthritis pain, just to further establish this connection between arthritis and inflammation, you take an anti-inflammatory medication and it relieves the pain. Oh, so anti-inflammatory reduces inflammation. That means the pain of arthritis is being caused by inflammation. Well, why is your body inflamed? Well, one reason is the joint space is irregular. These are not the knuckles I was born with. Look how big they are, right? Over time, joints become slightly deformed and the surfaces are irregular. And once they're irregular, they continue to move, and that movement causes more abnormality. So they're inflamed because the joint is abnormal. It's not, 10-year-old joint. But you have a lot of days with arthritis where you have no pain. And you certainly have parts of the day with no pain. So what's going on there? If it's all due to the joint, and the joint doesn't change day to day, then why is it sometimes painful and sometimes not? Well, one theory is it's because of our bodies. Sometimes our bodies are more inflamed than others. And that's medically undoubtable. The blood test, which tells us the degree of inflammation in our blood, the most sensitive one for early changes is called the CRP, C-reactive protein. It's a chemical in the blood which indicates your body's state of inflammation. If you get a cold or the flu or COVID or something, your C-reactive protein goes way up. Your body is inflamed. You're acting on inflammation. And then it comes back down as you get better. There are fluctuations in the degree of inflammatory compounds in our body. That test is in your blood, right? They didn't draw that fluid from your throat that's infected or your knee that's infected. They withdrew that fluid from your blood. These inflammatory components are in your whole body. If your body is inflamed, then one thing that can feel the brunt of that are your joints. And a flare-up in your joint inflammation is a flare-up in your joint pain. So the first treatment for that for most people is mild exercise. Motion is lotion. So arthritis, motion is lotion. But then the second thing is anti-inflammatory medications. And I would say these days, we don't have really solid evidence on this, but it makes sense. So it's definitely worth trying. And frankly, it's healthier anyway. A really good thing to think about trying is an anti-inflammatory diet. And we've actually got some reports I want to look at later on anti-inflammatory diet, so we'll hold on to that for later. All right, look, I just totally went off, but I think you get it, that we're talking about the knee, and the big three are arthritis, meniscal tears, and ACL tears. But there's actually a fourth that's probably the most common cause of everyday knee pain, not associated with any injury or an underlying condition like arthritis, and that's Patellofemoral Syndrome. So the patella is doctor word for your kneecap, and the femur is your leg bone, and there's a ligament that goes, a tendon that goes between your patella and your femur, and that is called the patellofemoral tendon. It is very prone to wear and tear over time and inflammation, and that's what this article is talking about, that condition. So let's finish it up and see what else they have to say about it. So we got this misstatement by this doctor. Let's ignore that. And then a much more common source of knee pain is a condition called patellofemoral pain syndrome, aka runner's knee. You also sometimes hear it called jumper's knee. It's under the kneecap. It's common in runners, cyclists, and anyone who sits for a living. This doctor says the pain usually starts out mild but becomes progressively more intense and increasingly present if not properly addressed. Why your knee hurts when you bend it, and here's a person with knee pain. Well, everything might feel fine when your knee is straight because that tendon is relaxed. It can really stand out when you bend your legs or squat. Typically, your kneecap glides smoothly, but in this condition, it doesn't. They want to look at whether your patella is tracking correctly, and they make really good recommendations. Chiropractors and physical therapists as well can really help look at your gait and how you're using your knee and make sure that you're using it in the best possible way so that it can be not painful. How to stop knee pain, and here's somebody putting ice on their knee. You know, we talk about this a lot, but the first thing you do if you have pain in any joint is rice and said, rice and said. RICE is an acronym for rest, not totally bed rest, light activity, water walking, just things that don't involve impact. Elliptical is a fair cardio, bike is a fair cardio that does not involve impact. Rest, ice, like we have in that picture. RICE, elevation, getting it up, and the C is compression, which for the knee is a neoprene sleeve. You see the athletes wear them in the sporting events, just a plastic sleeve that goes around your knee. They have them now that are made out of material. You can get them on Amazon. If you're having acute knee pain, we did put out a really good video that goes through rice and said, and I would strongly recommend that you check it out on YouTube. Just pop it in, it's 5 minutes, and it'll go through all the things you should be doing. So that's the rice and said, NSAID, non-steroidal anti-inflammatory drug. So rest, ice, compression, elevation, and then non-steroidal anti-inflammatory drug. It's like the world's longest acronym, rice and said, but it's really, really helpful for those acute injuries. NSAIDs are just absolutely a two-edged sword. NSAIDs are very safe early on, unless your doctor tells you you're not a candidate to take them. Most people can take NSAIDs if you have a heart condition like a stent. Your cardiologist may have warned you against them, or coronary artery disease. Otherwise, they may have warned you against them. But short term, most people are stable. If you have a heart condition or a kidney condition, you want to check or an ulcer, you want to check with your doctor before trying any NSAIDs. And I personally recommend just don't take NSAIDs. The most common complication or problem with an NSAID is ulcers in the stomach, and you can really help yourself out and stay safe by taking a Pepcid AC, that's Pepcid famotidine with Tums, anytime you take an NSAID to block the acid reaction in your stomach. Prilosec is better in the sense that it's once a day, But if you're going to take an NSAID, I would say just take some kind of a acid blocker for your stomach with it, even if you don't have an ulcer, just to protect yourself and make sure you don't get one. The last thing we want to do is go from one problem to another, right? So that's a very healthy and good tip to just don't take an NSAID. Like NSAIDs, by the way, Aleve, ibuprofen. There's 100 of them. Mobic, Celebrex. There's literally 100 of them. The best one for you, I always say, it's just like ice cream. You know, chocolate, strawberry, and vanilla, they're 99% the same, but they affect us differently. And you may be a chocolate person. You don't ever eat vanilla and you hate strawberry. So it's the same with NSAIDs. You got to find one that works for you and take that one, but take it with something to protect your stomach as well. If you have ulcers and you just don't want to go there with NSAIDs, then a good backup is Tylenol. Tylenol doesn't have, it's not an NSAID, it's an anti-inflammatory, but not a non-steroidal anti-inflammatory. And it's a little different in that it doesn't cause the acid response. So good old-fashioned Tylenol it can be helpful. And sometimes you can find there's a Tylenol arthritis. That's a really good option for people with joint pain. Really good option as well. All right, so a little detour there on rice and SED, but I think it's important, and I want to make sure you're covered. The second thing that came up today was a very interesting article on the link between the diet and arthritis. And I do want to talk about that. This is from the Monitor. Came out yesterday or today. I don't see a date on this, but it was, I saw it today, Monday, September 26th. So it came out yesterday. And one of the great things about these articles on anti-inflammatory diet stuff is they always show you this really awesome picture of healthy foods. And here's really healthy looking strawberry and kiwi and grape, and it just makes you hungry, doesn't it, looking at all these delicious anti-inflammatory fruits. What you need to know, rheumatoid arthritis and osteoarthritis is also associated with low vitamin D in the blood. Only few foods replace vitamin D. There is an association between arthritis and low vitamin D. I'm not 100% certain that this association is not a stress one when you're in pain and have a body stress. Vitamin D can be very nonspecific. You should normalize your vitamin D anyway. It's not only important from an anti-inflammatory point of view, but it also has significant implications for your immunity. Very surprising in the COVID epidemic, pretty convincing reports that people with normal vitamin D were resistant to COVID infection. Anyway, they go through the types of arthritis. That part of this article, the recommending vitamin D, I would more strongly recommend an anti-inflammatory diet, but again, normal vitamin D is important. And inflammatory arthritis, such as rheumatoid arthritis and autoimmune conditions, can affect the joints. Yes, they can. Non-inflammatory arthritis, such as osteoarthritis, I wouldn't think of osteoarthritis that way. I actually think of it as an inflammatory condition as well. It's just caused by the inflammation. What starts it out are abnormalities within the joint, as opposed to rheumatoid arthritis and others where there are inflammatory conditions outside of the joint, which we should think of. And then there are connective tissue diseases such as gout. If you've had gout, I'm sorry, it's just such a painful joint issue, but it's another one that we need to think about. Does diet influence arthritis? There have been theories, but there's no proof. I agree with that. There really isn't proof, but it's a hard thing to prove. But there are some foods that are generally deemed helpful, and fish is definitely one. 3 servings of fish a week are recommended by almost everyone these days. There's no strong science, but there's a lot of good evidence to think this would be the right thing to do. And if you don't mind eating fish, just substituting 3 oily fish meals a week for your regular, into your regular diet is a very helpful first change. Oily fishes are salmon, halibut, swordfish, and then all the white fishes like tilapia that seem to have different names everywhere, but basically white fish that can be served as an entree. Fruits and vegetables, especially vegetables, very, very helpful. Oh, I got a little technical timeout. I'm going to be away for 3 minutes. and then we're gonna come back on with our live. So hang on, and we'll get right back to you. We're back. Sorry about that. New show, and we're very excited to bring it to you, but we got a lot of technical, as you might imagine, there's a lot of technical stuff we got to work through, and we're working through it. It's looking good, but it takes time, and we'll get there. And remember, this is a live show. If you are getting this and you want to talk, then please give us a call. We'd love to hear from you, and love to get you on so that everyone can benefit from whatever your experience is as well. That's, for most of us, that's really the best way to learn. All right, having said that, let's finish up this article from the Monitor on arthritis. Does diet influence arthritis? I think it does. And here are some helpful things. Remember the fish, definitely. Fruits and vegetables, definitely. And olive oil. Oils are very important. And the oils that are bad for you, like the Crisco that I grew up on, you don't want to eat that. It's very highly inflammatory, and if you just substitute olive oil as a general rule as your only oil at home, that will be a very healthy hack for you and a very good substitution. All right. Okay, you're interested in going on an anti-inflammatory diet, I hope. That's just a huge issue. It's a big change in diet for most people, and it can definitely be overwhelming. You know, one thing we've learned as doctors over the years about diet is the quick and dirty way of having a prescribed menu for every meal. It's extremely effective for a few weeks, but it's just too restrictive. And over time, what happens is everybody, 95, 100% of people, relapse back into their old diet, and it's just not helpful to make a change for 2 or 3 weeks to make these changes and really get the benefit of them, we need to make these changes for life. And so to make long-term significant changes in our diet really requires an incremental approach. I think the incremental approach is just a lot healthier. And so I recommend that you start making a change. And one really simple change to make is to substitute a smoothie for your first meal of the day. So many people are doing intermittent fasting that maybe you're not eating breakfast anymore. Well, then maybe try a smoothie for lunch or whenever you break your fast. Or if you're eating breakfast, just substitute a smoothie for your old breakfast. And a smoothie gives you some real opportunities to add strongly anti-inflammatory elements. And here's a really cool article that gives you 8 really good suggestions. 8 anti-inflammatory ingredients that will add major protein to your next smoothie. So anti-inflammatory and providing the protein that we need for healthy muscle maintenance and certainly building. And again, always these great photos. But they go through basically 8 suggestions. Number 1 is chia seeds. Delicious, interesting texture, and very, very healthy. Walnuts. Walnuts are just fabulous for you. You know, the diet that I believe in, if you want to really go on, if you say, okay, great, but I need to do something now, I need a crash course, I recommend the Fat Resistance Diet. It's a book by a doctor who developed the diet for his patients who had arthritis. And then he published it because so many of those arthritis patients were losing weight. So he published it as a weight loss diet, but it really was originally an arthritis diet. Really outstanding book. But he makes Leo Gallant, he makes a really important point, and that is walnuts are much better for you than peanuts. So at least in his opinion, I don't have any biochemical evidence for that, but I really give a lot of credibility to this guy. And I think I would, if you're going to put nuts in the smoothie, go with walnuts instead of peanuts. Oat milk, certainly more healthy for you than regular milk. Cocoa nibs, delicious and healthy, full of anti-inflammatory compounds. Almond butter, spirulina, hemp seed, and flax seeds. All really, really healthy and give you fiber as well as protein and really can help move up that smoothie. You know, in talking about anti-inflammatory diets, it's such an important topic and it's such a difficult one that we actually did make a playlist here on the channel, which you can use to transition into an anti-inflammatory diet. Natural healing for joint pain, anti-inflammatory diet. There's some text there that kind of goes through what we've been saying here. But then make changes. The first change that I would recommend is to drink turmeric and ginger tea every night before bed. Turmeric is a very widely ingested compound throughout the world, and it's extremely well studied as an anti-inflammatory. It's an anti-inflammatory. I mean, it's natural, but you could almost think of turmeric as an anti-inflammatory drug. Very strong anti-inflammatory. Ginger is number 2 in terms of inflammation fighting. So turmeric and ginger as a tea, it's delicious. You can drink it before bed. I find that people who try this notice substantially less stiffness when they wake up in the morning. So that's kind of your marker, if it's working for you, is whether or not you get reduced stiffness in the morning. So I would start out with a turmeric tea. You know, life is life. You go through, we have the holidays coming up. It's only September, but pretty soon we're going to have Thanksgiving and then party, Christmas, Hanukkah, whatever you do, Kwanzaa, and then we come into the new year. We're heavy, we're inflamed. Sometimes you just need to hit reset. And so a lot of people will do a quarterly anti-inflammatory diet as a cleanse. So they'll start out with an anti-inflammatory restrictive diet where you limit the compounds you're eating, and then move on after 3 weeks and you feel better, then you can start reintroducing regular foods and move on. That kind of cleanse approach is really, really powerful for your health. And you can do a cleanse anytime you feel crappy. It doesn't have to be quarterly. I really like the book Clean by Alejandro Junger. He's a doctor who's also very familiar with Ayurvedic medicine. And Ayurveda is the kind of form of medicine most widely practiced in India. And Alejandro Junger's book, Clean, is a really excellent 3-week cleanse. I strongly recommend it. If you are really ready to make this transition and you drink the tea and you like it, we did put out this 27-minute video on 5 steps to reduce your joint pain. It's really a transition to an anti-inflammatory diet, and it's called the TOAST method. T is the turmeric tea. O is the oils, changing from Crisco to good healthy oils like olive oil. A is an Ayurvedic cleanse. S is a statin, which is a medication that reduces your cholesterol, but also just dramatically reduces inflammation in your body. And T is a measurement. You want to measure this whole process, and that's following your blood level of CRP on a quarterly basis with your doctor so that you can keep your inflammation down. Keeping your inflammation down through this kind of diet is good for your heart, it's good for your gastrointestinal system, and it's really good for your joints as well. So check out our playlist, and in particular, when you're ready, that toast diet. And then there's some other, excuse me, there's some interesting, here's a video we did on vitamin D, which I was talking about earlier, anti-inflammatory elimination, and then even an interview about CBD. Some people are using CBD to help reduce inflammation as well. Okay, we're gonna go to last topic for today is the total hip replacement. So total hip replacement is drastic, right? You're getting a new joint. It's not something you consider unless you have chronic hip pain. But for people who need it, people with more than 12 weeks of hip pain due to arthritis, or if you have developed osteonecrosis, which is also called avascular necrosis, or if you're born with an abnormal hip, it's called a hypoplastic hip. It just, over time, it worked fine for a while when you were young, but as you got older, your congenital deformity led to pain in the hip. Then total hip replacement is a blessing. It's really probably the best surgery on the musculoskeletal system historically. Patient satisfaction is 92%. So it's really, really an excellent surgery. But it's like anything else, you need to get the best. You deserve the best. And so you want to make sure you have total hip replacement with a surgeon who does it in the right way. And you want to look to our channel to find out what those criteria are. It's just amazing how many people end up needing total hip replacement. And it's often surprising because our kind of, excuse me, our kind of stereotype of total hip replacement is an 80-year-old person who needs it, but it's sometimes much younger people. In fact, Adam Sandler, the comedian, had a total hip replacement last week. And I wanted to show you this clip of Mr. Sandler out walking.
I wanted to make sure that I was ready to vote this November. And I heard you could check your voter registration. All I did was go to planmyballot.com and follow the steps.
Skip the ad. So here's Mr. Sandler with some paparazzi. And his operation was last week, but he's walking pretty well. And he's got his crazy comedic dress with his Hawaiian shirt and his basketball pants. But you see, one thing about him is you see that he's walking with a cane. One of the most common questions that we get about total hip replacement is, well, how long will I need a cane? And the answer is, as long as you need it. When your operation is done right, so it's done with a complication rate on hospital compare by an experienced hip replacement surgeon who's fellowship trained and uses a robotic assistant, you probably don't need that cane for more than a day or two. One of the most common questions we get, we have a lot of people who fly into town, have a hip replacement surgery, they get the cane, they come back before they fly out in 2 days, and they're like, what do I do with this cane? You know, so that's a good sign. It's really there to make sure that you don't trip And if you're more comfortable using it, use it. Some people will even go for a few weeks. But how long do you need a cane after a total hip replacement? As long as you need it, but a lot of patients, that's about 48 hours. Well, I'm sorry we we didn't get anybody calling in today. Not entirely surprising because you don't know we're on, but we are going to be on every day at 10. So if you catch this today through your feed, then please feel free to contact us. You can contact us through the channel and we can set you up, upload any images that you have, and we're ready to go over your questions and comments on the show. So please feel free to contact us, and we'll look forward to catching you tomorrow. For Best Practice, I'm Dr. Dan Lieberman. Have a great day.